the guy. Let me start with the arteries first because there's more of them. Excuse me, there's less of them than there are veins. Let me make sure I got the. All right, good enough, I guess. You can see it more or less. All right, so let me just take it as we're coming then, I guess, out of the left ventricle. Actually, wait, let me just start in the thoracic cavity. What's, we're looking at arteries. What's this artery? Pulmonary artery, right? It's a weird one, but that's the pulmonary artery coming out over there. What's this thing here? There's the aorta, right? This technically is considered the ascending aorta, then the arch of the aorta, and then what you can't see on this model, but then it becomes a descending aorta that goes sort of on the posterior part of the thoracic cavity and then into the abdominal cavity. When you're looking at the descending aorta in here, it's referred to as the thoracic aorta. When you're looking at the descending aorta down here, it's called the abdominal aorta. What's this thing? You really can't see it because the vein's in the way, but there's something going up here. Does anyone know what that is?
Carotid.
It's not the carotid. Anyone know what? Yeah, it's the brachiocephalic artery. There's a brachiocephalic. What are the first branches that you have off of the aorta?
There's 3 of them, right?
All right, it's kind of a trick question. Anyone remember the first arteries to branch off of the aorta? It's the coronaries. Remember the little coronary arteries come off? You can't really see them on this model. Anyway, whatever. But the first big branch to come off is the brachiocephalic artery. It's going up there. There's only one brachiocephalic artery, but there's 2 brachiocephalic veins. There's a left and a right brachiocephalic vein. There's just one brachiocephalic artery. So please don't say like left brachiocephalic artery, or I'll have to mark it wrong. Okay. Anyway, so this is it. You can't really see it, but then it goes up here, and then it divides. What does this become? Anyone know? That's the common carotid artery, and then what's this guy that's going over here? That's the subclavian artery. Okay. This little guy that's going up there, anyone know? That's the vertebral artery. If I could then move this. There's, again, your brachiocephalic, then you've got your common carotid, here you've got your subclavian, there's your vertebral. If you go way up in the neck, this would be approximately where that carotid sinus was I was talking about. Now, this model is like this. The guy has his head turned like that, so just kind of get your bed. They just did that so you could see these arteries a little bit better. But this guy that's going up here on the outside of the skull and going to the muscles and the skin of your head. Does anyone know what that is? No, that's not the jugular. The jugular is a vein. This guy that's going up here is the external carotid artery. Okay? When you look at somebody head on, oftentimes when an artery branches, if it goes lateral, they'll say external. If it goes medial, they'll say internal. It's just a general rule. So this guy, if you looked at somebody head on, would actually be going out like that and going up to the muscles and the skin of your head. So that's the external carotid. This little guy that you're seeing here is actually going medial, and it's going deep up inside your skull. That's the really important one. That's your internal carotid artery. You can't really see it because it goes into your skull, and then it feeds your brain with all the blood and with most of the blood flow. Okay. All right, let me back down here again. Side I want to use. I'm going to use this side over here. Okay. Again, here's your subclavian artery. Now, the subclavian artery continues along, and it stays the same blood vessel, but it changes names depending on where it's at. There are boundaries. There are muscular boundaries that determine when the name changes, but unfortunately on this model, on most of the diagrams, they don't show those muscles. But when you get around into the armpit region, it changes its name to what? Anyone know?
Axillary.
It's called the axillary artery. And then as you get further down in the arm, it changes to the brachial, okay? It's gonna go down in the arm. And it's basically going to give off two branches, one that goes over here and then one that goes over there. This is someone's left arm. So does anyone know what that artery is? That's the radial artery, and then this is the palmar artery. And there's actually that palmar arch I was talking about, the collateral, the anastomosis and the collateral circulation. Remember that vaguely from 2 hours ago or whatever it was? All right. Going into the abdominal cavity then. Yeah, not too bad. All right, so here is your abdominal aorta. All right. This is known as the celiac trunk. There's basically 3 unpaired arteries that come off of the anterior surface of the abdominal aorta. There's the celiac trunk, which is right here. There is something called the superior mesenteric artery, or SMA. And then there's one, it's really tough to see. Once I get this right, this one's right. Is that making it better? I don't know. A little better that way. There's one right here called the inferior mesenteric artery, or the IMA. So there's the big ones to know about: the celiac trunk, SMA, or the superior mesenteric artery, and then the IMA, which is located there. These two guys on the sides are actually smaller ones. They're called the gonadal arteries. You don't have to worry about those for test purposes. The celiac trunk goes and gives branches off to the spleen. So this is known as the splenic artery. Okay. This one that goes over here is the hepatic artery. It's going to the liver. The superior mesenteric artery goes, and it's actually really important. It gives blood flow to most of, you don't have to tell me where the blood flow goes, I'm just giving you a heads up. It goes mostly to all of the small intestines and most of the large intestine. And then the IMA goes down and does like the last part of the large intestine. One pair of really important arteries that you can't see here very well at all because they're behind the vein. Does anyone know what arteries you'd find coming out here that you can't see really well?
The renal.
The renal arteries, all right? They're going to your kidneys. You can't see them because they're behind the renal veins, but trust me, they're there, and they're super important, and they're direct branches off of the abdominal aorta. Okay. As you move along, the abdominal aorta branches into, what are these guys? Those are the common iliac arteries. Okay? Now, the common iliac artery goes a little ways, and then it branches into this guy and into that guy. Okay? What do you suppose this one's called that's going medial? That's the internal iliac artery. Again, that's another example of when things go medial, they call it internal. And then what's this one? External iliac artery. As you go down further, so up here, then, was the external iliac artery. As it crosses over your hip bone, it changes names. And so right after it crosses over, what is it called?
Femoral.
It's called the femoral artery when it crosses over. Okay? The femoral artery then goes down. It gives off something called the deep femoral branch, which I don't think you have to know about. But it goes down, it goes behind your knee. Does anyone know what it's called then?
Popliteal.
It's called the popliteal artery. And then it branches into one artery that goes sort of to the anterior part called the what? Anterior tibial, and then one that stays in the back called the posterior tibial. Okay? So that's basically it. Like I said, there's a pulse that you can feel here on the surface of your foot called the dorsal pedis pulse. There's also one underneath your ankle on the medial side called the posterior tibialis pulse. So the deep, well, anyway, whatever. So that's the arteries. let me go through the veins now. Start back up here. All right, good enough. So, what do you suppose this is? Superior vena cava. What's this guy down here? Inferior vena cava. Good. What are these guys? These four guys? I'll answer at once. Those are the pulmonary veins, right? Don't be confused, right? They're going to be red because they're going back to the heart. But, I mean, excuse me, they're veins because they're going back to the heart, but they're red because they've just picked up oxygen from the lungs. Okay? So those are the pulmonary veins, and they're going to be dumping into the left atrium. Okay? As you said, this is the superior vena cava, and then you have the left brachiocephalic vein and the right brachiocephalic vein. Okay? Then you've got this guy here, which is known as the what? Anyone know? That's the internal jugular vein. And then this one over here, the smaller one, is the external jugular vein. The internal jugular vein goes deep inside your brain and drains the blood out of your brain. The external jugular vein kind of does what the external carotid does. It drains the blood from the muscles and the skin of your head. Okay. Then what is this vein? Subclavian vein. Okay. Let's see here. I'm going to back up here. I'm going to go over to this arm on the. All right. So this is the subclavian vein up there. Now, for whatever reason, they don't really go in and they don't show you like the brachial vein like you would see. The thing with the veins, the reason why there's more veins than there are arteries is because you have a deep set of veins and you have a superficial set of veins. The deep set of veins have names that match up with the arteries. The superficial set of veins have their own separate names that are kind of crazy. So this model, for whatever reason, doesn't show the deep set of veins that you have in your extremities. It's just showing you the superficial ones. So, you know, like you had a brachial artery, you'd also have a brachial vein, but this model doesn't show it for whatever reason. What the model does show, though, is the superficial set of veins, and this one that's over on the side here is the cephalic vein, and then this one that's going down here is the basilic vein. Then you have what's called the median cubital vein crossing over, and then you have a radial vein and an ulnar vein on the sides. Down in the abdominal cavity, then, what's this guy again? Inferior vena cava. Okay. What are these guys here on the sides? The renal veins. Good. What you also have here, anyone know what this vein is? That's the splenic vein. Okay. Just like you had a SMA and an IMA, just like you had a superior mesenteric artery and an inferior mesenteric artery, you also have a superior mesenteric vein and an inferior mesenteric vein. So this is the superior mesenteric vein. You can see it's draining the region that was supplied by the superior mesenteric artery. And then here is your inferior mesenteric vein that's draining the area supplied by the inferior mesenteric artery. This is a gastric vein that's going up there, so it'd be going up to where the stomach is. And then this guy here is a big important one. Does anyone know what this guy is in purple?
Okay.
That's the hepatic, and this is the tricky part. Make sure you get the word portal in there. This is the hepatic portal vein. Okay? I'm going to get into the portal circulation system on Tuesday, but this is the hepatic portal vein. It represents blood that's been coming in from the intestines, from the spleen. The purpose of the hepatic portal system is to take food, nutrients, other things that you've just absorbed in your intestines, and it takes that blood flow immediately to the liver. And if there's any toxins or anything bad in the foods that you've just eaten, the liver gets a crack at trying to detoxify it before the blood flow goes out to the rest of the body. So this is the hepatic portal vein, and it's a way of sending all of the blood flow from your digestive organs to the liver first, and then it goes out. The reason why I'm emphasizing the word portal is because this is the hepatic portal vein, whereas this little guy in blue here, does anyone know what that is? That's just the hepatic vein, okay? The hepatic vein takes the blood out of the liver and puts it into the inferior vena cava, okay? So make sure that if I point to this, you don't put in the word portal, and make sure if I point to that, you do put in the word portal, okay? So there's two ways for blood to get into the liver, the hepatic artery and the hepatic portal vein, and then there's one way for blood to get out of the liver, and that's the hepatic vein. That's right there. Other branches that you see here, I'm going to go down. And let me go on the, well, I got to go on the right side, I'm not even showing it on the left. Once again, you'd have an a common iliac vein up there, and then you'd have an internal iliac vein, and then the external iliac vein continues on. When it passes over to the hip bone, it changes names to the femoral vein. You have a deep set of veins in the legs. The deep set of veins in the legs have the same names as the arteries do. So there's a femoral vein, popliteal vein, etc. But then there's also a whole new superficial set of veins that have funky names to them. This is the biggest vein in your body. This is a superficial vein. Does anyone know what that's called? It's the longest vein in your body, I should say. That's the greater saphenous vein. So it's on the medial part of your leg. All right. So that's the great saphenous vein. This little guy on the side is called the short saphenous vein. I think that's pretty much it for blood vessels. Again, spend time looking at actual pictures too, because there's a good chance I'll use like diagrams similar to your book.
That was a lot.